And in terms of, again, perhaps one last question, in terms of, you know, evolving things and where things might go in the future, where do you see things going? Or I know there's even different surfaces that are available now. Traditionally, it's, you know, like you said, it's a metal prosthesis, but again, what's your experience or thoughts in terms of either now and where things might go in the future with regards to different materials on the bearing surface of the knee?
Yeah, well, I think, yes, you're quite right that the National Joint Registry that I've mentioned before gives us quite a powerful tool in terms of advising what works and what doesn't work. And for knee replacements, a cobalt chrome alloy metallic implant on the end of the thigh bone, which rests on a cross-linked polyethylene plastic piece on the top of the shin bone, seems to work very well for the vast majority of people in the long run. For the younger patient where you're trying to improve longevity, you want to reduce debris formation. We've talked about the polyethylene being quite an aggressive active debris when it is produced. There are ceramic options that are available. I think they're a bit of a niche at the moment. People are still worried about the fracture rate for ceramics. So for ceramic as a bearing surface is a wonderful thing. We use it routinely in hip replacements. It's a very slippery surface. When you've polished it, it has what we call a good wettability. So it lubricates very well. And we see generally less polyethylene formation, debris formation, with ceramic against polyethylene compared to cobalt chrome against polyethylene. But the technology for creating these ceramic implants and getting longevity from them is still a bit contentious. I know what you're going to ask next. Is there a role for pyrocarbon? So pyrocarbon is a wonderful surface with very good friction characteristics. In non-load bearing locations, then it seems to work very well. We've certainly been using it in, not myself, but my colleagues that do hand surgery. It's got a long track record for doing little mini joint replacements in the fingers and the knuckles, which seem to work really well with good long-term data. As we've discussed before, there is a trend towards trialing this at the level of the shoulder joint. When you're in a load-bearing position, the ankle, the hips, the knees, not sure whether pyrocarbon is the future or not. It's very early days to say. I think we need to wait for more data. At the moment, if our National Joint Registry tells me that a cobalt chrome implant works very well with a polyethylene load-bearing surface, then I'm happy. There are things that we've been tried, changing the cross-linking in the polyethylene. One of the companies routinely provides a polyethylene that's been enriched with vitamin E, which is designed to improve its longevity. We need data from thousands of these to know whether it works or not.
Yeah, the data's not quite there. I know on the shoulders, for example, I think the early, sort of the early versions were showing signs, were showing a high fracture rate, and then the slightly more evolved ones have been less so. But the early ones did certainly fracture. So I think, like you say, it's a different joint, it's a different part of the body. So it's who knows what the future holds. But it's interesting, isn't it? These
absolutely,
where these things might